Good morning. My name is Audrey Gaes. I am the current acting chief social worker for Erongo region. Today we will be talking about stigma. I am from the Ministry of Health and Social Services in Erongo region. Upon the request of Ministry of Education for their Heritage Week celebrations, I have been tasked to talk about stigma inside our Erongo region community. So, stigma in regard to COVID-19, as we all know, we are currently in the pandemic, in a state of emergency of COVID-19, the coronavirus. And with the coronavirus, various social problems have either developed, or some of them have just been, so to say, fueled more. Some of them has increased. So stigma is one of them that is standing out in the community, and this is what we're going to talk about. So what we'll look at is we'll talk about what is stigma, and then I will take you through as in what stigma does to the different individuals that are suffering the stigmatization, and then we'll also talk about what are our roles as individual persons, as community members in the fight against stigma, because stigma is a very negative thing towards a human being who's suffering from a certain disease or a certain ailment. So what is stigma? Stigma is it's discrimination against a specific group of people, and it can be, let's say, an ethnic group. It can be different social groups, as in, like, to say maybe we would say currently, like, people are saying, oh, Wuhan is the cause of corona. So stigma is associated discrimination identified with a specific group of persons. So it can also be linked to a specific country, a specific place, so to say. Like currently in Erongo, people are joking to say that Walvisby was the new Wuhan due to the cases that were there, and which is not a good thing. It's a very negative thing, because then we are stigmatizing Walvisby. It seems so innocent, and people joke with it, but then in the end, for people who are living in that community, it's not nice, because now they are afraid other people are afraid of them and so forth. Then what we'll then look at is, so why does stigma take place? Why does it happen? So there are various reasons that stigma can take place. One of them is stigma is associated with a lack of knowledge about how COVID-19 spreads. So many of us still don't know how COVID-19 spreads, and this can cause that we are stigmatizing other people. Then the need to blame someone. You know, obviously when we are trapped or feel trapped in a situation as human beings, we feel like we need to blame someone. We need to put the blame on someone. You know, it's the Chinese who caused this, it's the WHO, it's this Ministry of Health that is causing these things, or it's a lie, you know, that kind of a thing, and that also leads to stigma. The other reasons why stigma takes place is it's the fear about the disease and death that is associated with the disease, which is now the coronavirus. It also gossip that spreads, and rumors and myths. Also, fear and anxiety about a disease can lead to social stigma. You know, just the fear of corona itself, the fact that we are afraid of corona, that can also lead to stigma, because then we reject people who cough or who sneezes, or people who are in our family, and then maybe they will just be ill with something else. Now, because we are afraid so much of corona, in everything we start to see corona, and that is also causing for us to panic and then also stigmatize other people. Which is also, the other reason is also its negative attitudes and beliefs toward people, places, or things. currently, when it comes to the negative attitudes, a lot of our information in our minds is full from what is running around in the community. For example, we have the various theories, conspiracy, whether they are conspiracy, whether they are factual, nobody knows really. So we have various theories that are running around on social media platforms, and a lot of people read up on these things on their cell phones, and read up on things on Facebook, WhatsApp, and this also leads that people can develop negative attitude surrounding the virus itself. And with this, in the end, people can stigmatize, or people can also be in denial that the virus is existing. So, and this can lead to that some of them will have careless behaviors, and others would now start discriminating. Oh, this one is not looking after themselves, so we should not associate ourselves with this person. Okay, so who are the groups of people who may be experiencing stigma during COVID-19 pandemic? Of people who might experience stigma during COVID-19, it can be certain racial and ethnic minority groups, including Asian, sometimes foreigners, travelers, or truck drivers, especially in our country currently now. If we say ethnic minority groups or ethnic groups including Asians, currently everyone says, it's a China virus, it's the Chinese virus, and but imagine what the Chinese community in our communities might be going through, or across the world, what they are going through, because the virus has been blamed on them, as in they are the ones who brought the virus, or they came with the virus. The other ones can then also be travelers, like the tourists and so on, or people who've been in other countries and coming back into the country. They might also experience stigma, because now that you're coming from South Africa, or you're coming from America, or you're coming from the UK or China, you are stigmatized because of that. People are afraid of you. People say that, you come back and you are back here now with this virus. So these are the groups of people. Truck drivers, all of us have read up in June, July. A lot of us, through print media, social media, have vented out on the truck drivers that they are the ones bringing the virus. And there was a point that they really felt stigmatized, rejected, and then blamed for things that they are not responsible for. Okay. Also, people who tested positive for COVID-19 have recorded from being sick with COVID-19, or were released from COVID quarantine or isolation. So these are the other groups of people that is currently experiencing stigma. Some of them have been kicked out of their houses, the way they were renting. The landlords don't want them anymore. That is discrimination. Some of them, because they were positive, some of them, the family members don't want to be associated with them as well. So a lot of people are really experiencing a lot of rejection, and this falls under discrimination and stigma combinedly together. And then also emergency responders or health care providers. I think there was a point somewhere beginning May, March, whereby people would not want in certain shops for the health workers, like the nurses and them, to enter their shops, or they were afraid immediately if the health workers enter the shops, they would maybe immediately shift their mask, right? Started sanitizing, everyone looking at them, and so on. So these are also the group of people that can, from the community itself, experience the worst stigma, as being labeled as the people who are kind of, due to the confusion that is there, who are blamed for spreading the virus, or making people live in fear with false information and so on. Or sometimes also because, you are the ones who work with those people, so you moving around in the community, you are also spreading the virus. Because sometimes people will say that automatically, because you are in the hospital set up, you are already sick, and you are the one who's maybe even spreading around the virus. The other ones would then be people who have disabilities or developmental or behavioral disorders, who may have difficulty following the recommendations. With that, what we are saying is, let's say take someone who's probably mentally ill and is suffering from a type of mental illness whereby they are unable to have self-control, to wear the mask, to follow the protocol that are put out during this state of emergency. So these people can experience stigma, because now they will be all over the place, and then the family, when they come home, might say that, you've been working all over the place, and now you want to bring the virus to us. So silently, these people with certain mental disorders or mental illnesses can be stigmatized as well due to that. People who have underlying health conditions that cause a cough, let's say you don't have flu or you don't have any coronavirus, but you have a condition whereby, some people will say my throat is always irritated. So once the throat is irritated, they always kind of like cough just to try and clear the throat, but not because they have flu or any other illness. So these kind of people will also suffer stigma because people will always move away from them because now they are coughing and people are afraid that they might be having corona and spreading this virus. And then lastly, people living in congregate or group settings such as people experiencing homelessness. Let's take our informal settlements. With this, we are saying people who are living in ghettos that can maybe accommodate up to 20 people in the same yard or up to 50 people in the same yard. These people might also experience stigma because now we are talking about social distancing and what, and people without really understanding can take this, twist it to their own understanding and then say that, no, because you guys are a lot there, you are the ones who might be having the coronavirus and you are the ones spreading this virus. Now, let's look at a bit of effects of stigma. So, stigma is a discrimination against a specific group of people, be it a place of origin or a country or a community. Then we looked at now, so why does it happen? We look at the lack of knowledge. We looked at people who are not understanding the virus correctly. And then we looked at now to whom, which group of people are experiencing stigma. We want to then look at, okay, so what if I'm stigmatized? So why is this woman sitting here today, this social worker, talking about stigma? It's for us to understand, like, this is what is happening, but it's not just happening. After happening, there's something that goes along with it. And that something is that we are human beings, all of us in a society. So just like we fight for GPV, just like we fight discrimination against the disabled and mentally ill, just like we fight for people who are physically disabled, who's got physical disabilities, just like we fight for people who are HIV positive to have their rights. There are so many upcoming things as development comes that we are fighting for to say that, but this person also has a right. Based on this, we also wanted to say that, stigma during Corona or during COVID-19 is also not good. And the following are the reasons why it's not good. So we will look at the effects that stigma has on people and why we are speaking up against stigma. So stigma can lead to labeling, stereotyping, and discrimination, and other negative behaviors towards others. Stigma hurts everyone by creating more fear, anger toward ordinary people instead of focusing on the disease that is causing the problem. Stigma can also make people more likely to hide symptoms or illnesses, and that is the worst of it all. Currently, a lot of people are, warning each other, so to say, no, don't give my number. If you give my number, this is what I'm going to do to you. And then a lot of people are also not coming up to say, I'm not well, because they are afraid if they test positive with COVID-19, then they will be maybe losing their job, or they will be put out of their renting place, or they will be rejected by their family. And this is based on the experience of what they are already seeing happening to other people. So the more the people are hiding the illness or going for testing, the more we might have that the illness can spread. And a lot of people, currently the death rates are already concerning that we are having in our country. So the more people will start hiding due to stigma, the more we can actually eventually in the end fuel the death rate to go up, because people will only look for services once they are totally ill and unable to move and someone else is taking them to the hospital. And this is what we don't want. We want our people to priorly already be tested, and for them to know, as Ministry of Health and Social Services, and for them to know what their status is, whether it's COVID-19 positive or negative, and then they are able to know, okay, so it's not COVID, so maybe there's something else, and they can look for other medical assistance rather than just worrying about COVID-19. And with that, for people to also look for ways to improve their living circumstances as well as their immune system. So the other effects then can be them from seeking healthcare immediately. I think we've touched on that. Prevent individuals from adopting healthy behaviors. This means that stigma can make it more difficult to control the spread of an outbreak. This is not just every effect that is there of stigma. There can be worst of effects of stigma, but the basic ones, the most crucial ones, are these ones that I am currently touching on for us to become aware. Stigma can also negatively affect the emotional, mental, and physical health of a stigmatized group or an individual or the community they live in. Stigmatized individuals may experience isolation, depression, anxiety, and public embarrassment. And these are the effects of stigma, and this is why we wouldn't want individuals to be stigmatizing against each other. The question is, if you were going through something, would you want to be supported, or would you rather prefer to be rejected by someone? And if you would feel like, okay, one day if I'm ill or if I am in a situation, I would want support, I would urge then for us to think about what it is that we are doing to the next person during this COVID-19 pandemic, and then how we are supportive to the next person and what we are doing in helping to curb the spread of the virus. This means that stigma can make it more difficult to control the spread of an outbreak. So this is not just every effect that is there of stigma. There can be worst of effects of stigma, but the basic ones, the most crucial ones, are these ones that I am currently touching on for us to become aware. Stigma can also negatively affect the emotional, mental, and physical health of a stigmatized group or an individual or the community they live in. Stigmatized individuals may experience isolation, depression, anxiety, and public embarrassment. And these are the effects of stigma, and this is why we wouldn't want individuals to be stigmatizing against each other. The question is, if you were going through something, would you want to be supported, or would you rather prefer to be rejected by someone? And if you would feel like, okay, one day if I'm ill or if I am in a situation, I would want support, I would urge then for us to think about what it is that we are doing to the next person during this COVID-19 pandemic, and then how we are supportive to the next person and what we are doing in helping to curb the spread of the virus. Okay, lastly, I will conclude by saying, so the role all of us play. So what is the role that all of us play? Just like I said now, stopping stigma is important to making all communities and community members safer and healthier. Everyone can help stop stigma related to COVID-19 by knowing the facts and sharing them with others in their communities. So what this is saying in the end is, let's compare stigma, what it is doing to individuals and our communities at large. Then also look at the COVID-19 pandemic. Then we look at the information that we have. And it's time for us to assess what is a myth that is sent out to create confusion and what is factual information, so that we can then within inside us choose to follow the factual information that is out there, and then fight out the myth that is causing more fear, more anxiety, more ignorance, creating lack of understanding because we don't trust what is the true information. And then with that, to say that for us, then know that, okay, this is factual information because it's coming from WHO, and the ministry adapts what WHO is saying, and WHO is also adapting to what the scientists that are supporting them or that are in collaboration with them, as saying they don't just cook up something and bring to the table for the entire world. So let us compare factual information with information that is created by anyone just to spread confusion and fear, because the reality is, however we would want to say it or call it, COVID-19 is there. If we don't call it, some people are saying there's no corona. Let's just be aware that there's something out there, and some of us are saying that it's because people are tested. It's those test sticks that are spreading this virus. Mind you, there are people who, without being tested, have looked for medical help because their conditions were not so good, because they were afraid to go for help in the beginning. And in the end, it turned out that this person is suffering from COVID-19. And then it's out there, whether we like it or not. There is something out there that is really hurting our people, affecting our people negatively. So as a social worker working for the Ministry of Health and Social Services, I just wanted to say that the health workers are really trying their best and doing their best in order to help curb the virus. But we can only do this with your support and assistance. And Stigma is not helping us in any way, because it's not helping the next person, your neighbor or your brother or sister, to freely go for testing when they are feeling ill, and for them to be helped on time. And then through that, the virus keeps spreading. So let's all play our part. Let's compare myths versus facts, and then cross out the false information, and then keep to the true information, the factual information that is there. And then I conclude.